Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. Evidence-based practice is the conscientious integration of best research evidence with clinical expertise and patient values and needs in the delivery of quality, cost-effective health care. Best research evidence is produced by the conduct and synthesis of numerous high-quality studies in a selected health-related area. Evidence-based practice is the goal of the nursing profession. At present, some nursing interventions are evidence-based, while some are not. The Institute of Medicine's 2007 annual meeting focused on evidence-based medicine and the changing nature of healthcare. Presenters at the annual meeting discussed the need for a stronger focus on evidence to ensure that the promise of scientific discovery and technological innovation is efficiently captured to provide the right care for the right patient at the right time. In 2011, the Institute of Medicine published another report with recommendations for the profession of nursing. These recommendations were detailed in their summary entitled, "The Future of Nursing, Leading Change, Advancing Health." This report contained 8 recommendations. Recommendation number 2 involved evidence-based practice. Expand opportunities for nurses to lead and diffuse collaborative improvement efforts. Private and public funders, healthcare organizations, nursing education programs, and nursing associations should expand opportunities for nurses to lead and manage collaborative efforts with physicians and other members of the healthcare team to conduct research and to redesign and improve practice environments and health systems. These entities should also provide opportunities for nurses to diffuse successful practices. This recommendation for evidence-based practice in nursing includes the advice that, quote, performance measures should be developed and implemented expeditiously where best practices are evident to reflect the contributions of nurses and ensure better quality care. Evidence-based practice has many benefits in nursing. For example, evidence-based practice in nursing is expected to improve outcomes for patients, providers, and healthcare agencies. On a very practical, concrete level, evidence-based practice may promote quality, cost-effective care that meets hospital accreditation standards. The American Nurses Credentialing Corporation, ANCC, Magnet Recognition Program, recognizes evidence-based practice as a way to, quote, improve the quality of patient care and to revitalize the nursing environment, end quote. The synthesis of best research evidence, that is, research synthesis including systematic reviews and meta-analyses, have provided the foundation for developing strong evidence-based guidelines for practice. Such guidelines provide gold standards for quality patient outcomes in a select area. The American Nurses Credentialing Corporation, ANCC, Magnet Recognition Program selection criteria for magnet status includes the following 3 criteria concerning evidence-based practice. Criterion 22. Describe how current literature appropriate to the practice setting is available, disseminated, and used to change administrative and clinical practices. Criterion 27. Provide evidence of education and mentoring activities that have effectively engaged staff nurses in research and/or evidence-based practice activities. Criterion 28. Describe resources available to nursing staff to support participating in nursing research and nursing research utilization activities. Barriers do exist to the implementation of evidence-based practice in nursing. For example, there are both practical barriers and conceptual barriers. Some examples of practical barriers include 1. Lack of research evidence regarding effectiveness of many nursing interventions on patient outcomes. 2. Limited systematic reviews and meta-analyses in nursing. And 3. lack of studies on effectiveness of nursing interventions to individual patients. Some examples of conceptual barriers include: 1. Evidence-based guidelines must be used in conjunction with clinical expertise and patient values and needs, rather than as a cookbook for management. And 2. Lack of resources allocated in institutions to implement evidence-based practice. Synthesizing nursing research evidence can focus on a specific area or intervention for practice or on complex clinical problems. 2 major entities have been established in nursing to support evidence-based practice. One is the Cochrane Nursing Care Field, established in 2009 to establish the evidence base of nursing care. It includes 11 different fields, one of which is the Cochrane Nursing Care Field, which supports the conduct, dissemination, and use of systematic reviews in nursing. The second entity is the Joanna Briggs Institute, established in 1996 to promote evidence-based health care internationally. This institute also provides evidence for locating and conducting research syntheses in nursing. The Joanna Briggs Institute, which originated in Australia, is an international evidence-based organization. It has a search website that includes evidence summaries, systematic reviews, systematic review protocols, evidence-based practice recommendations, best practice information sheets, consumer information sheets, and technical reports. One title of a registered systematic review is Recovery Perceived by People Living with Severe Mental Illness in Community Settings, a systematic review and meta-synthesis conducted at the Japan Center for Evidence-Based Practice in Japan. This title is one of 246 entries included on their website in October 2015. This website is a robust source of information on systematic reviews and evidence-based practice. To review, a systematic review is a structured, comprehensive synthesis of the research literature to determine the best research evidence available to address a healthcare question. The steps of a systematic review are based on the statement published by PRISMA, P-R-I-S-M-A, in 2019. This statement was developed by an international group of expert researchers and clinicians to improve the quality of reporting for systematic reviews and meta-analyses. PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analyses. There are several steps in the guidelines for implementing and evaluating systematic reviews. The steps used in conducting systematic reviews are: 1. Formulate the relevant clinical question to direct the review. 2. State the purpose and objectives or aims of the review. 3. Identify the literature search criteria and strategies to be used in conducting the search. 4. Conduct a comprehensive search of the research literature. 5. Select the studies for review. 6. Critical appraisal of the studies included in the review. Employ inter-rater reliability of 2 or more independent expert reviewers. 7. Conduct a meta-analysis if data are available and if appropriate. 8. Compose the results of the review. 9. Develop the discussion section of the review. And 10. Develop the final report for distribution. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017 edition, by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.